Hello, my name is Lucy Santana Takagi, and I am the current president of the New Jersey Psychological Association, NJPA. I am very excited to be recording this video to invite you to a very special event that's going to take place at NJPA on September 25th, 2020. This event is a conference, and the title is Access to Care and Maternal Health Disparities Across the New Jersey Landscape. Now, information about this conference and all the presentations involved in it are just below. So click and find out what we're offering. This is an all virtual conference. And I wonder if you knew that in 1987, about 7 women for every 100,000 women would die from childbirth and childbirth-related illnesses. That's in 1987. But in 2016, that number increased to about 17. And that's on a national level. So about 17 women out of every 100,000 women die from childbirth-related issues. In New Jersey, however, every 37 women out of every 100,000 women die from childbirth or childbirth-related issues. There are many medical conditions that explain and are influenced this high statistic, but there are also social and psychological conditions that contribute to this number. One of these social and psychological conditions has to do with the indifference of the mental health field. Now, why would healthcare professionals be indifferent to pregnant women? Well, actually, the numbers indicate or suggest that, at least in New Jersey, there is a higher rate of deaths, about 3 or 4 times the amount of deaths that occur for white and Hispanic women take place for African American women. So if African American women are 3 or 4 times more likely to suffer from childbirth and childbirth-related illnesses that lead to death, why would that be? And one of the factors that research actually suggests that seem to be influencing this high number has to do with indifference from healthcare workers. So if that is taking place, what is the psychological impact, even for mothers who survive childbirth and who are African American? What is the psychological impact for a child? What about the infant mental health? What happens to that bonding and that relationship when you go through so many struggles during pregnancy? So this event is very special because New Jersey actually at this point ranks numbers 47 out of 52 states in terms of maternal mortality. Now, as you know, especially if there is disparity in this rank, we need to understand as psychologists what are the factors contributing to these disparities and what are the medical factors that women need to be mindful of and need to understand to seek help when needed. So I think this conference is going to be extremely educative for all of us, whether you live in New Jersey or whether you live in another state, whether you have a state that actually attends to this national statistic and addresses it from a psychological perspective, or whether you don't. And then you can actually use this event to start the conversation with your psychological association and with your state regarding maternal health and infant mental health. Please consider joining this conference. We welcome everyone. The price is very reasonable, so I'm sure you're not going to regret it. I am positive that you're going to learn a lot. We have wonderful presenters, and you're going to learn a lot from their expertise. I hope to see you there. Look for the information, click register, and I'm looking forward to seeing you and to talking to you during the conference. Take care.